As we finish out the month that celebrates our nation's independence, we at ATR TV thought it'd be good to talk about how you could get independent from pain. It's actually not as overwhelming as you think. It starts with just one step, so stay tuned. Hi, I'm Stulginsky, physical therapist with Ayrsley Town Rehabilitation, certified by the Titleist Performance Institute. I'm here to tell you that getting independent from pain is actually not very overwhelming. It starts with just asking one question: why? If you have pain from something other than a traumatic incident, then you need to be asking the medical professional treating that pain, why did this happen? If they can't answer, then you need to find someone who can. For the most part, we treat orthopedic, muscle, and joint pain different than all other medical issues. Let's use a heart attack as an example. If someone has a heart attack and their heart stops, the symptom is the stopped heart. So you're going to jumpstart the heart with either AED, defibrillator, or CPR. Going forward, you're going to run a battery of tests to identify risk factors or causes of the stopped heart. You may see modifications to lifestyle, diet, exercise, cholesterol, or blood pressure. For most people, this approach makes sense. However, for orthopedic pain, we approach things very differently. We see frustrated patients in our clinic all the time where they've been given anti-inflammatory medication, an injection, and then sent on their way. The symptoms are treated, but the problem's not. Let's use the shoulder as an example. We see patients all the time that have received anti-inflammatory medication or injection, and they're simply sent on their way. The symptoms are treated, but the problem is not. It doesn't seem to be a good strategy to jumpstart the heart and not make modifications to cholesterol, diet, exercise, and blood pressure. So if it's not a good strategy for my heart, then why is it a good strategy for my shoulder? It doesn't make any sense. There could be a multitude of reasons you have shoulder pain. We'll go over a few right now. You could have a weak grip that causes your shoulder to do more fine motor tasks. You could have a limitation in your low back or your mid back that adjusts where your shoulder blades sit in. It is the foundation for your rotator cuff. If the foundation's not there, the structure's not going to work, and it may ultimately fail. You could have a problem with your pelvis, your hips, your knees, or your ankles, either on the same side or the opposite. Now you may be asking, how does something like my ankle affect my shoulder? It's not structurally connected, but it is through function, and it is through movement. And if these problems aren't addressed, the pain comes back, when in actuality, the symptoms were treated, the problem was not. The heart was shocked, but there are no modifications to lifestyle, diet, exercise, blood pressure, or cholesterol. This has a lot to do with the primary source of pain: previous injury and poor treatment. See, too many people think that injection and anti-inflammatory medication is the end game, when in actuality, it's the start of letting us know the whys of your pain puzzle. The physical therapy professionals at ATR understand movement. We understand function. We can understand, identify, and treat the whys of your pain. For more information on how, please check out our website at www.ayrsleyRehab.com, where you'll see links to our Twitter account, our Facebook page, and our blog, where you'll get daily health, fitness, and movement tips. I'm Stulginsky, physical therapist with Ayrsley Town Rehabilitation, reminding you, we don't just treat your pain, we help you solve it.